Hi, my name's Sabrina. I'm a student physical therapist assistant at Owens Community College, and this is my professional development video for PTA 108. So just a couple improvements that I think that I've made based on feedback would be better time management. Still not great time management, but at least better time management, I would say. I've been better at looking at the syllabus, marking things down, knowing when things are due and how long it's going to take me to complete things as opposed to waiting until last minute. Still not great at it, but working on it. And then another thing would be just being more confident in my skills and my abilities. Just kind of knowing that I have the knowledge and I do have the skill. Otherwise, I still wouldn't be in the program if I didn't. So just being confident in my skills and my abilities. And then to maintain these improvements that I've made at home, it's just been helpful for me to stay more organized and have better time management at home, which then helps me transfer it into school. I don't have to be as stressed out about home stuff, so I can kind of focus on school stuff. And then I do have a giant desk calendar that I have yet to use, which hopefully I'll be using in summer semester to stay even more organized with stuff. So write down due dates. It's just something that I see every day. So I feel like it would be helpful if I started to utilize that. And then just again, being confident in my abilities. So just knowing that I know what I'm talking about and being confident and continuing to learn and try and be hands-on when I'm learning things, just so I feel more confident when I'm completing skills or discussing things with patients. And then in clinic or working with a patient, time management is super important. We don't get a lot of time that we get to spend with our patients. So it's really important to know how much time each thing is going to take, and what you're going to do in a treatment session. That way you know, okay, I need to hit this, this, and this. And just kind of managing your time or managing my time, just so I know, okay, this is really important. We have to do this today, as opposed to being really disorganized and getting to not all the important things that we needed to get to, or not getting as far in a treatment session as I had planned. So just having my time a little bit organized will be helpful in that situation. And then being confident in my skills and my abilities. I feel like your patients can read when you're not confident in what you're talking about, or you're not confident in what you're doing. And I feel like that's shown a lot in practicals versus skill checks. I feel like skill checks, a lot of us are more confident because there's nothing kind of on the line, versus a practical. You can kind of tell when people are nervous. And so I'm trying my best to just remain confident in my skills, because when I display confidence, then my patients are confident that I know what I'm doing. They can trust me a little bit more. Maybe they'll be more compliant with home exercises, or just more compliant with therapy in general. So I feel like that's really important in the clinic setting. And then what I learned from class this semester that will transfer hopefully into clinic life is just being more hands-on in lab. And a little bit more situational, as opposed to last semester. I think it was okay, this is what we're going to do. This is how we're going to do it. Here's what we're doing. Follow these instructions and do it. As opposed to, I think this semester, it's a little bit more of, okay, here's your patient. What are you going to do? You have all these things that you can do. What are you going to do? And I feel like that's helpful in a clinic setting, because it's going to be, here's your patient, here's the protocols, do things, as opposed to this is exactly what you're doing. So I think having the practice cases with the patients is really helpful. And then even merging the practice cases between 108 and 110 is helpful, especially for the final practical coming up. Just knowing how to merge the two cohesively, as opposed to making it really, really choppy, I think is helpful, having those kind of hands-on practice cases. As for closing thoughts, I don't really have any. I will just be studying for my practical, the combined practical here shortly. So, bye.